Good afternoon, and thank you for joining me today. And it's always a good day when I can report that we have no new cases of COVID-19 here in Erie County. So our total stands at 93 cumulative positives, 2,290 negatives, and 75 people have recovered. Contact tracing, as always, continues at the Erie County Department of Health. Crawford County has 19 cases, McKean is reporting 6 cases, and Warren County remains at 1 case. Chautauqua County has 37 cases and 4 deaths, and Ashtabula County now has 149 cases and 16 deaths. The state total is now at 50,957 cases and 3,012 deaths. So please continue to stay at home as much as you can. Wash your hands frequently for at least 20 seconds. Wear a mask when you do leave your home, and keep a distance of at least 6 feet from anyone who does not live with you inside of your home. Our environmental team has, they received 39 new complaints, and so they're out there continually making their field visits to assist our businesses as they reopen in Erie County. As you know, Governor Wolf's office released guidance last evening, but we still here in Erie County have a lot of questions. So the environmental team has compiled a list of those questions, sent it on to the state this morning to get some better guidance. And we have been told that we should be hearing something shortly. We've heard just on a few of the questions, but there's many more that we need some clarity on. I'd like to remind everyone that our goal is not to hammer down on businesses, but really to have a helping hand for our businesses, to help you find ways to comply, to keep you safe, to keep your employees safe, and to keep your customers as they come in safe. We are treading uncharted territory together. We all want to reopen Erie County as quickly, efficiently as possible, but our number one priority is the health and safety of our community. Again, the only way that this works is if our businesses comply with the guidance and our residents adhere to it. As the state allows businesses to reopen, please keep in mind that everyone still must protect themselves and others from spreading COVID-19. The virus is with us, it is in our community, and it's always looking for that new host. And you don't want to be that new host. And so now I'd like to turn it over to Shar Behringer. She is the Director of Community Health Services at the Erie County Department of Health, and she's going to provide us with an update. Shar?
Thank you so much, Kathy. I'd like to talk about the differences and the similarities between COVID-19 disease and the flu. A lot of people are comparing the two, and it's important to know the facts so that everyone can understand how serious COVID-19 disease really is. So let's start with the similarities. We know that both flu and COVID-19 are respiratory illnesses. We know that they spread from person to person. We know that they both involve similar symptoms like fever, body ache, fatigue, sometimes vomiting, diarrhea, certainly cough. Both can be mild in some people, more serious and unfortunately even fatal in some others. Both can result in pneumonia, and both can be spread up to 2 days before the first symptom even starts to show. So that's where the similarities end. One of the major differences between flu and COVID-19 is the rate of spread. On average, one person with flu spreads it to another 1.3 people. I know you can't count 1.3 people, but you get the idea. One COVID-19 person, though, spreads it to 2 to 3 people. This means that COVID-19 is more contagious than the flu. The onset of symptoms is also a major difference. A person with flu typically experiences symptoms right away. It comes on very suddenly. A person with COVID-19 may have it, not feel any symptoms at all, and then the symptoms gradually begin to build. Because a person doesn't feel bad right away, they won't know that they're sick, and they can spread it to more people if they aren't taking the proper precautions. And again, these are the precautions we've been saying over and over, and they are so important. Wear a mask, maintain a 6-foot physical distance from people who are not in your household, avoid gatherings with groups, and practice proper hand washing throughout the day. Now, the next part's extremely important to understand. It's the comparison between the number of cases here in the United States. According to the CDC, in the 2018-2019 flu season, there were 310,489 reported flu cases. Now that's over the 9-month flu season. Since the first diagnosis of COVID-19 on February 27th in the United States, there have been almost 1.2 million cases reported in the United States. That's nearly 4 times the amount of cases in the 2.5 months as compared to the 310,000 flu cases in 9 months. You can see how much more contagious and easily spread the COVID-19 disease is when compared with the flu. What's even more telling is the biggest difference between the flu and COVID-19 are the deaths related to each illness. The CDC estimates that between 24,000 to 62,000 people die each year from the flu. In the 2018-2019 flu season, they estimated flu-related deaths, to 34,200. Now, according to Johns Hopkins University, 69,079 COVID-related deaths have already occurred in the United States since February. This is more than twice the number of flu cases, and these are deaths that have just occurred in the number of few months. All the data that I'm citing today can be found on the CDC website, and it includes U.S. numbers only. As the county executive and the health department director, Lyon, have said over the past few months, we're all in this together. The only way that we're going to get through this and prevent the spread is by everyone doing what they can to follow the guidelines. These guidelines are even more important with the stay-at-home order ending this Friday. Please do what you can to prevent the spread and help others to understand the differences between flu and COVID-19. Help them understand that why universal masking is in place, why we should keep 6 feet away from each other, and why we shouldn't gather in large numbers. It's a community effort, and we need you to do your part so we at the health department can do our part. Now, another topic I'd like to discuss is the terms isolation and quarantine. These are kind of new words in our vocabulary. We're not used to using them. Isolation is the term that we use in public health when someone has COVID-19 disease, so confirmed disease, and we need them to stay alone, basically. It's kind of the meaning of the word isolate. They need to stay in one room. If they're in a house where they live with other people, they need to stay in one room. Ideally, they should have their own bathroom, their own linens. They would need to have food brought into them. They're really to have contact with no one else in the house. How long this lasts will depend on really how long their symptoms last. It would be a minimum of 10 days for isolation. During this time of isolation, there's no visitors, there's no social activities, there's no leaving the premises. This is the time that people need to take to really let their body heal. Certainly treat the symptoms. We don't have a curative treatment for this disease yet, but it's a time to lay low and let the body heal. Now, quarantine is the word that is used for those who have been exposed to that person who has confirmed COVID disease. With quarantine, generally speaking, it will be 14 days. The reason for the 14 days is it can take that long from when someone is exposed to the virus to when they're actually going to develop symptoms themselves. There's a little bit of wiggle room on that 14 days if a healthcare worker is involved or if an essential worker is involved. But generally speaking, it's going to be 14 days. And even for the quarantine person, it's stay in the home, no visitors, no social activities, no going out. And again, this is really important because remember what I said, that this is a disease that we can have symptoms for 2 days before we can be without symptoms for 2 days before we even know that we have this disease. So it's very important to stay in and stay quarantined to prevent the spread of this infection to other persons in our community. Thank you so much.
Thank you, Shar. Always a voice of great knowledge and wisdom. Shar has been at the front lines of helping to lead our team with all of the contact tracing work that we've been doing. The epidemiology, she's been really working hand in hand with them, and I want to thank her and her entire team for the excellent work they've done, which has really helped to slow the spread and really take us to the point we're at today where we can go into the yellow phase. So I'm going to open it up to our press now for questions either for Shar or for myself. And today we're going to start with Jet TV.
Hi, Kathy. It's Samir. So this question is for you. Today during the state conference, Secretary of Health Rachel Levine said that masking was not required during the yellow phase with the exception of businesses. So I guess, do you have any input on that?
So my understanding is the state has kind of backed a bit away from universal masking. We're still trying to get some clarification on this. But businesses are required to have all their employees wear masks, and everyone entering their business has to wear a mask. So it's still mandatory for any business that you would enter, whether it be a grocery store, whether it be a retail outlet that might open on Friday, or any other business that you would enter into. You need to be wearing a mask, and all employees must be wearing masks. And it is up to the business to enforce this both ways, for their employees and for those entering. Now, in terms of universal masking, I've been talking a lot about it. Shar Behringer just talked about it. Melissa Lyons talked about it. We all still believe that this is the best way that we can help control the spread of COVID-19 here in Erie County. So, Secretary Levine says she believes that people in Pennsylvania will do the right thing and wear masks when they go out. And I have to believe the same. We really feel it's important that all of us, when we are outside of our home, be wearing a mask. We are requiring masks to be worn in county government by our county employees, unless they're completely by themselves. And when you're in your office space by yourself, it's okay to take your mask off. It's okay to take your mask off if you're by yourself in a car or just with the person that you live with in your home. But otherwise, you should have your mask on. And I just ask everyone to please consider this request and to please do the right thing for the people that you're going to come in contact with.
And then transitioning a little bit to those guidelines that you received last night from the governor's office, thoughts, opinion, reaction to that?
Well, the guidelines were nowhere near as specific as we had hoped. We still have many, many questions, and we're trying to get answers to those. I was able to get a few answers to a few things. I was told that funerals will be limited to 25 people max, and again, the same guidelines of keeping people 6 feet apart, everyone wearing a mask will still be expected within a funeral home. I have heard that hair salons, although they cannot cut our hair, are able to sell product. So they can become like a retail outlet. So if you need more hair product or something that you buy normally at your hair salon or your barber shop, that they can sell if they want to open just for that reason, but not for cutting our hair. And then at golf, if you're out golfing, we do say one person to a golf cart. But if you're golfing with your spouse or a child who lives with you or someone else who lives in your home, then you obviously can go 2 people to a cart for that purpose. But otherwise, it should just be 1 person to a cart on the golf course. And that there are not to be any gatherings over 25 people. That is still the number that the state has been stating, is that 25-person gathering. And even within that gathering, you should be physically distant from each other of 6 foot. And I recommend strongly that you all be wearing a mask. And we're hoping for more guidance. Erie Times News.
Hi, Kathy. It's David. Did you get anything specific about, you had mentioned the libraries, the dog groomers, the Mill Creek Mall. I know that's a particular place that's of interest to folks locally. Did you get anything on any of those kind of businesses?
We are still waiting guidance on all of those and many, many more. It's just, it's been a bit of a frustration because we want some clarity so that we can help our businesses. Our businesses are obviously needing this clarity because they want to get open and they need to know what they need to do. So we have asked, we sent our questions yesterday, we refined our questions a bit this morning after getting the guidance from the state that didn't make things clear for us. And like I said, I got a call and I got a few things answered, but we had expected more answers yesterday, and we're still looking for those, and we are hearing that we may get some more answers as the day goes on here, but that's what I had as of coming here today.
Do you have any indication why it's just so difficult to get clarification on this?
I don't really know, David. I wish I did know. We all like to deal in certainty. Uncertainty, I think, is one of the most dangerous things for any business. And so they need to have certainty of what they can and cannot do. So I ask the state continually for some more certainty so that we can all do the right thing and the best thing we can for our community as a whole. And it is frustrating. It's very frustrating for us as we try to be that helping hand to our businesses, to be that educator, and to help them do the right thing, because that's what businesses want to do. They want to do the right thing. So continue making your plans, and we'll get you the information as soon as we have it. Talk Erie.
Yes, hi, Kathy. It's Joel Natale. Thanks for taking my question. Just along those lines from Samir and David, do you think that Erie County or even greater northwestern Pennsylvania citizens should feel disrespected from Harrisburg because of this lack of guidance? I saw a statistic that the 24 counties only represent 12% of the population of Pennsylvania. Could it be that Harrisburg is just not that concerned?
I don't think that that's the case at all, honestly. I think they care very much. They want us to all be successful. They want us to show how the rest of the state can actually move into this yellow phase. Our population density is obviously much, much lower. We are the most densely populated county within the ones that are opening up to yellow on Friday. And I think the state does want to be a partner with us and help us to be successful. But I've said this from the beginning, when we started with this COVID-19, this is something that none of us could have prepared for. We've kind of had to build this plane as we started to fly it. I think here in Erie County, I think we've done an actually great job of building this plane as we have been flying it. But I think the state's also kind of dealing with the same thing. I think the federal government's dealing with the same thing. This is something completely unprecedented. And some of the guidelines that we even talked about a month or two ago are completely different. Let's just start with masks. We first told everyone not to wear masks. Now we're saying to wear masks. And I know that's confusing for the public. Some of that had to do with the supplies and what was available. Some of it had to do with just knowledge that we're gaining over time about this virus and trying to understand how it works. And some of this, I think, goes back to our economy and how do we get out of the trenches that we've actually kind of built for the right reasons to protect people's lives, but we got to get our economy back going, and how do we do that safely? So I think we're all trying to help each other and learn from each other, and I think the rest of the state will learn from us. And again, I continue to say Erie County, we're in a unique position. We have a health department. We have the personnel and the actual structure that was needed to open up to yellow and to do it safely. But my fear is that the other counties won't have maybe the guidance that we're going to be giving here. And that makes it difficult too. Because again, we're not trying to be punitive. We're just trying to keep this community safe and save lives and get businesses back up and doing what they need to do to keep themselves safe too and their employees. So I don't think it's a disrespect, but I do think it is that, there's not a lot of clear-cut answers in this COVID-19 scenario. And there's so much we still don't know about this virus, and that's troubling.
Thanks.
Erie News Now.
On your list of questions for the state, what are the two or three biggest ones that are still weighing on your mind, the ones that you say to yourself, boy, if we could get these cleared up, we'd have a viable shot at making this happen on Friday?
So we don't know, does this 25-person limit include everybody? Is it all your employees and the people that would be in your business? Does there anything to do with square footage? Because obviously we talked about this yesterday, I think, that, some buildings are very large and they could handle more than 25 people and still keep everyone socially distant and much safer. Some buildings are very small. They're talking about a 50% capacity, that you should reduce your capacity numbers to 50%. So there's just a lot of ambiguity around what do these actual numbers of people mean. And so we need some certainty on that. And then there's actually documents that contradict each other. Some documents are saying you may do something, and then other documents on the same subject say it's prohibited. And so we need some clarity on those conflicting documents, and so we are trying to get some of that answered too, so that, again, we can follow the guidance coming from the state.
Thanks.
Today I have with us also Hannah McDonald with Penn Capital Star. Are you with us, Hannah?
Yes, I am. Hi there, Kathy.
Hi.
So I was wondering, what has the overall response been that your office is seeing from the community and businesses? Are they excited? Are they looking forward to this? Or do they have independent concerns of their own?
Many businesses have concerns. We are getting inundated with calls, which every time that there's been something new that's come out of the state, this has happened. First when the business is closed, and then when the masking or guidance came down, and now here as we go into the yellow phase. And we have a very, very strong, what we call our enforcement team, but it's almost like our business education and assistance team. So they have been working with our businesses to help them figure things out and how they can do the guidance in a way that, you know, makes sense for their business. So that's what we're hearing. We had our marinas and our golf courses and our campgrounds open over the weekend on Friday last week. So we did some surveillance of those facilities to see how they were doing, and again, giving guidance to them of how they can maybe do a better job. And you know what we're hearing? I mean, it's varied, obviously, but the businesses are also worried. You know, the last thing any business wants to be is associated with some kind of an outbreak of COVID-19. And so they are, I think, very judiciously going about making their plans. We've actually had some plans sent to us. We've said we don't need your plans, but we actually have asked every business to have a plan. So if we do have a complaint from a citizen come into us and we call them up, first thing we're going to ask them is, do you have a plan? Tell us about your plan. And so we'll start with that kind of question. And these are the same people in Erie County who go out and inspect our restaurants and our tattoo shops and such. So they're very used to dealing with business compliance issues. And so it's actually worked out really well for us here in Erie County.
All right, thank you.
Jet TV.
Yeah, hi, Kathy. Samir again. So since there is kind of so many, I guess, gray areas or contradictions with what's been sent from the state, is there a chance the county could, I guess, take it up to their own ability and kind of make an executive ruling on stuff?
We've certainly talked about that, and that may happen.
Do you have, I guess, any, like what places are you thinking right now? Do you have any of them?
No, we don't have any specifics, but, you know, when there is ambiguity, I think we have to decide, you know, what does that mean for that business sector, so that, again, we want to give the right advice. We want to give the kind of advice that's going to keep everybody safe and also assist that business. And we also want to make sure it's equal. You know, we want to make sure that all of our businesses are competing on an equal level, and so you don't want one business doing one thing and then another business doing another when it comes to these guidelines and this compliance, and somehow you know, making them, I guess, unequal in terms of their ability to function. So those are the kind of things we'd have to look at going forward.
And then if I could ask Shar a question really fast.
Sure.
So just taking a look at where Erie County started when COVID first peaked in the county to where we're at now, I guess, what are your thoughts and opinion on how we've progressed?
I'm sorry, I forgot to unmute my phone. We have done an excellent job so far in Erie County in keeping our numbers low. There is great concern here among health department staff that as things loosen up a bit, that we will see an increase in numbers. We really, really need people to understand the importance of continuing with the social distancing and the masking and things that are going to prevent or at least lessen the spread of this virus.
Thank you.
Thanks.
Thanks, Shar. Thanks, Samir. And I do want to say, again, I didn't look at the numbers today, but pretty much every time I've looked at them, we still have about 30 counties in Pennsylvania who have greater numbers than us, and we are the 15th most populous. So we still are doing very, very well when it comes to our number of cases when you compare that to our population. And that's obviously congratulations to the great work being done by so many at the Erie County Department of Health. Erie Times News, David?
Yes, Kathy. While you're waiting for more clarification from the state on the masks, as well as it seems like Dr. Levine has made it more of a suggestion than mandatory, does that change how the task force and anyone doing surveillance for the county approaches the public if they're not wearing masks right now?
It doesn't change anything for the businesses, because that still is in place, that when you go into a business, you need to have a mask on, and when you're working in that business. And it's more of an issue when you're inside of a building, when you're outside, but it's still an issue when you're outside, especially when you're around other people in groups. So if you want to keep yourself safe, and if you want to keep those people around you safe, and your loved ones safe, then wear a mask. It's going to be that simple. Do you care enough about yourself and the people that you love and the people that you're around to wear a mask? And it's a small thing to do. It can be an inconvenience at times. There's not every moment that I love wearing a mask, but it's the right thing to do. And so are you willing to do that? And that's the question I think you just need to ask yourself.
And then a follow-up, Kathy, how long can you wait for the state to come out with guidelines on, let's say, that whether the Mill Creek Mall can open or not before the county would make a decision on its own? I mean, is this something that needs to come tonight? Does it have to be tomorrow? How much longer can you be kind of left waiting on this?
I think we need our answers before the day's out here today. It's already Tuesday. The yellow phase starts on Friday. That's very little time for our businesses to know, what this guidance means for them. And so I've sent a couple emails, I've had a couple phone conversations, and I know that there is a team of people that have been sitting down and looking at that list. So we are asking for that clarification as soon as we can get it, and hopefully that will be today. Talk Erie. Joel.
Yes, I have a question for Shar. Shar, maybe you could help us out on timelines between testing and when an isolation order would be issued by the county health department. It's been since the middle of April, and then we had another peak in late April when we had those multiple tests. And again, those could have been data lags and so on. But do you guys find out a positive and then issue an isolation order, or are people connecting with you saying, I've got symptoms, I might be sick? How is that all working?
Okay, what happens when someone has symptoms and they choose to get a test, at the point that they get the test, they are instructed to quarantine while they're waiting for the test results. Once the test results come in, they might come in to us through electronic reporting. They might be reported by the facility or the practitioner that submitted the test. The point that we receive notice of a positive test, that is when we instruct the person in with the isolation directives.
Has there been a tightening up of the test lags since, it's been, there's more tests available, I should say, or is it still taking up to 7 to 9 days?
I'm very glad to say that most of our tests are turning around in less than 3 days at this point. Again, it depends on the vendor and the volume of tests that particular vendor is experiencing at the time of submission.
Thanks.
Thanks, Joel. Erie News Now.
A question for Shar, if I may. As we head toward this yellow phase, obviously nobody has a crystal ball, but people can do modeling and experts can predict things to some extent. What is a realistic look in terms of a spike in cases here? Ordinarily, fortunately today, no new cases, and we've had plenty of days with 1 or 2. So let's say ordinarily we've been 4 or fewer cases per day. What's realistic as we start to increase socialization?
We would not be at all surprised if we saw a double or tripling of our numbers.
And is that, obviously it's worrisome in that it's a doubling or tripling of numbers, but from a public health perspective, from a capacity perspective, in terms of being able to treat everybody, is that a concern at all?
We are actually in the process of looking at hiring a host of temporary workers. We're in the process of the human resources and things that need to occur to make that happen. Here at the health department, as long as we continue to shut down all of our services, we can have anywhere from 10 to 12 investigators a day, and they're also doing some of the contact tracing. But if numbers get that high, we're going to need this additional help. So we're recognizing that. We've identified training materials that are appropriate to use. and we'll bring them on board as soon as we can work out the HR processes.
Thanks.
Thank you. Penn Capital Star, Hannah?
Yes, thank you. I'm wondering, is Erie County considering placing any of their own travel restrictions on summer tourism as Memorial Day comes up and then the 4th of July with our beautiful lakefront and nature?
So we know that we are a tourist destination, and I think more people will decide to come to what we call the North Coast rather than maybe the East Coast this year. That does worry us greatly. We have many counties in Pennsylvania that are still under a stay-at-home order, and yet we're very aware that last weekend, particularly as the marinas began to open up and the campgrounds opened up, that we had people from, we'll say, the Southwest come up here to get their boats in the water, to check on their camper that might be at a campsite, etc. And we think that will continue to happen. Concerns us greatly, and we also sit, of course, next to Ohio and next to New York, both who've had their own issues with COVID-19. As we look at the three cities of Buffalo, Cleveland, and Pittsburgh, all who've had very large caseloads and many deaths, those have been the things we have watched all along the way, because we all have very close ties to those three cities from Erie, whether it be for sports, healthcare, family, shopping, just a myriad of things that we all like to do in those larger cities. So these are things we've looked at from day one, but we don't really have any legal recourse to stop people from coming into Erie County, and that's a concern. It really, we do ask people to stay home, to stay back in their county if they're under the reds, to stay under the stay-at-home order until that is lifted out of their county. And that just makes it even more, I guess, important that people who live in Erie County understand the risks that are out there, understand that not all the people you come in contact with have lived and stayed in Erie County for the last couple months, where we have much lower numbers, that these people who you might come across at an ice cream store, or when you go into one of our box stores or grocery stores, or when you're at your marina or your campground, that these people may have come from a place where the incidence is much higher. And so make sure that you do all those things. Wear your mask, stay 6 feet apart, wash your hands frequently, use hand sanitizer, etc. And if we do that, hopefully we can stay safer and keep our numbers lower.
All right, thank you, County Executive. I have no further questions.
Okay, thank you, Hannah. Jet TV, do you have any last questions?
Yep. Hi, Kathy Smirgan. So let's say, obviously, we're in the yellow phase, and we do see a peak in numbers. Is there a chance that, I guess, we could be moved back to the run phase?
There is a chance. They have said that at the state level. If the case numbers go up, there has been a number put out there of 50 cases per 100,000 over a 14-day period. Of course, Erie County's never come close to those kind of numbers, but as Shar mentioned, we could see a double or a tripling, and this thing could get out of hand fast if we don't continue to stay on top of our contact tracing, our quarantining of individuals who have contact with positives, and with our enforcement and our businesses being our partner in this. So we're going to continue all the really hard work that we've been doing up here. Since we had our first case back on, I think it was the 18th of March, we have been doing this really hard work, and we're going to continue to do it to try to keep our community safe.
So safe to say you feel it's unlikely then?
I can't say it's unlikely. This virus is tricky. This virus is sneaky, and we don't know. We don't know what's going to happen with this virus. None of us would have predicted what happened across the globe, back even when we first heard about this in China. I think many of us didn't think it would ever hit our shores, and now we have the largest death toll of any country in the world. And so these are the kind of things that we've got to understand are unpredictable, and none of us can say what's going to happen in the future. And we can't be successful if the residents of Erie County don't partner with us, because we cannot bring in enough manpower to do anything if people won't help us. And so, again, we're doing a lot of different things, things I don't even talk about when I'm on these press briefings, to try to assist people. I've talked a little bit about how we're doing a number of our information pieces in different languages, because we know people in our community could be watching me but can't understand a word I'm saying. So we're trying to get some things out, actually almost like a door-to-door campaign, getting things into people's hands who we believe may need some different instruction in different languages. doing that through our food distribution centers, through our school district food distribution, through a number of different means. We're looking at creating more testing in the inner city particularly, and we know that our Zone 1, Erie City, has had the largest numbers of cases, so we're trying to see how we can make testing easier and more accessible. And so we're really working hard to try to find ways to control the spread of COVID-19 here for all citizens. And again, it's just going to be a joint effort, and citizens have to be partner in this. Erie
And
Times.
then just one
Okay, sure.
last question.
Sure, Samir.
Can we expect any enforcement action at places like Frontier, Dobbins Landing, Presque if people are gathering, I guess, 25 or more?
So we have asked our partners to help us with that. You know, the DCED, of course, is in charge of Presque State Park as well as the Bluffs Park out in West County. And we've asked them to do their part in controlling the activity on those places. The city would actually be the one to control what happens on their city parks, as would every other municipality in our community. We don't have enough enforcement teams out of the health department to go out and patrol all of those outdoor spaces, but they're all controlled by somebody, some entity, some municipality, some state agency. And so we need their help in helping and it's not about bringing the hammer down on people. It's about actually explaining and educating to people the danger that they may be putting themselves and their family and their friends in. And that's really what this is about. So how can we better educate the community as a whole?
Thanks.
Erie Times News, do you have any final questions?
Yes, Kathy. If you do find out from the state later this afternoon or this evening, will you be posting that information on the county's website, including if you find out certain businesses are able to open on Friday?
We will try to get the we'll try to get the word out to the businesses who've been calling us as quickly as we can, and I think posting it obviously would be very, very helpful if we can get that up there. Hopefully they won't let us know very late into the night when I might not have any staff to do that, and that's sometimes the problem too. So my staff works long hours as it is, but I wouldn't really expect them to stay until 10 or 11 or 12 at night to post something, and they would do it first thing in the morning. So again, it would just depend on what time it comes in, but when it comes in, we'll try to get it out to the businesses for sure as quickly as we can, especially with those that we know are sitting there kind of waiting for an answer.
Thank you.
Sure. Talk Erie. Joel, do you have any last questions?
Just real quick, you had on your list yesterday church gatherings. Obviously, I get a lot of questions about churches. Is that still limited to that 25 or less?
So the state can't really enforce any restrictions on churches, and that has actually been since day one. But churches of their own volition decided to close down to protect their congregants. And when you're in church, what's the first thing you do? You come in, you greet those that you celebrate with, hugs, handshakes, whatever. It's usually a very close-knit group of people. And then you stand there and you worship together and you sing. And when you sing, and we've talked about the water droplets coming out of your mouth and your nose, and when you sing, you're now projecting those even further. And so those are some of the dangers that happen when we are in church together, and or worshiping in any one of our faith expressions. And we also know that many of our elderly are very committed to their faith expression, and they are our most vulnerable population. So again, the state, because of the separation of church and state, can't put those kind of restrictions and enforce those, but it's highly recommended that if a faith expression is going to begin celebrating again together, that they do that with no more than 25 people, that they keep everyone 6 feet apart, that everyone be wearing a mask, and that we use all those really good guidelines that we've been talking to. Those are difficult sometimes in a church or a temple setting. So each faith expression is going to have to decide what's best for their congregants and decide how they move forward on that.
Thank you.
Sure. And I think Erie News Now, I think you're last on the list today, and do you have any further questions?
I do. One final one for you, if I may. I think it was Friday, about 40 local municipal leaders, a lot of township supervisors, sent a letter to both you and the governor urging you to reopen as soon as possible, trying to outline some of the decimating effects that the pandemic has had on their areas. Just your thoughts on receiving that letter and the concerns expressed in it.
I agree with their concerns. We're all very concerned about so many of the things that have happened as we've had to shut things down. But, you know, when you think about the numbers that Char Behringer talked about, and that all happened within basically a 2-month period with basically a country that was all under a stay-at-home order, at least for the last few weeks. And so just think how devastating those numbers would have been if we had not done that at the moment that we did it. And in Erie County, you know, we've lost 2 people, and that makes me very sad, but I'm thankful that we haven't lost a lot more than that. And so we had to do, I believe, what we needed to do at the time, but I do believe it's time for us to figure out how we get back to having an economy that's up and going, how people can get back to work and get money in their home to pay their bills. And we've got to find ways forward, but we've got to do it safely and securely. And so, I mean, I've talked to many of those elected officials, and I think they all know that we all want to get back up and going. We all want to get to that place where the economy is working again. So I understand their frustrations, their plea, and we were actually already moving towards the yellow phase, and I pretty much knew that we were going to be in that. So I think that we are very fortunate here in Erie County that we are in the yellow phase. There are many, many, many counties in Pennsylvania who want to be in the yellow phase and aren't. So we're going to hopefully prove to the rest of the state about how this can be done, how it can be done safely, and hopefully keep our numbers at a reasonable level going forward. Again, I plead with everybody to help us be that example to the whole state.
And just your advice for them as they try to balance municipal budgets, try to make sure that they have enough money for everything that they've got to handle with trying to keep people safe as they try to walk that tightrope. Your advice?
Well, my advice is, I guess, the same thing we've done in county government. We've tried to cut our losses as much as we can. You know, we've really put the clamps down on spending, and we've had to furlough, unfortunately, some of our employees, but they'll be coming back. You know, they still are getting health care benefits. They will pay for that when they come back over a period of time. But we've been able to do some of those things, which are not easy, but at least it helps our budget as we're going forward. And we've made some changes even to the end of the year that are going to be in place so that hopefully we can come out of this year with our budget somewhat intact. So these are, you know, the things we're dealing with. You know, as much as we all hate paying property taxes and we complain about that, at least in Pennsylvania, that's where many of us are funded. And in other states where they rely on sales tax to fund local government, they are in much, much worse place than we are because having no sales tax hardly coming in. And that's unfortunately where the state is going to be looking at some big, big holes in their budget going forward. So it's not going to be an easy road ahead for local government, for state, and for federal. And it's certainly not an easy road ahead for our businesses as they try to get back up and going and become profitable again. So I want to finish off today by saying it is Giving Tuesday, and it's a response to really the unprecedented need that has been created by the COVID-19 pandemic, inspired by Giving Tuesday. It's called Giving Tuesday Now, so it's the hashtag Giving Tuesday Now, and Giving Tuesday usually occurs in December. So this is a day to come together and really support each other during this crisis. People can show their generosity in a variety of ways during Giving Tuesday Now. You can help a neighbor, you can advocate for an issue, you can share a skill, or you can give to causes that you truly care about. Every act of generosity today counts, as it does every day, and you can learn more at now.givingtuesday.org. So with that, in closing, I ask everyone to please stay home as much as you can, to stay safe, and to please continue to stay calm. Thank you.